All right, we are live. So we're going to see how this goes. As always, if you are watching, you know these things are always entertaining with technology, and we're just going to. All right, we are live. So we're going to see how this goes. As always, if you are watching, you know these things are always entertaining with technology, and we're just going to. All right, we are live. Okay, now I got myself muted. Okay, that was really weird. Okay. Okay, all right.
That's a great start.
I feel like the pink from your flowers is like bouncing off to my face because I am like blushing like crazy right now. Okay, so
No
hi
need.
everybody. This was supposed to be streaming live to Moksha Massage and Wellness, and due to technology, we're just gonna roll with it. So hey, it is Wednesday, you guys. We made it to another Wednesday. We can take a deep breath. So for those of you who are watching, and this is on, you're viewing this not where it's supposed to be, all month long, as you've been seeing in posts, we've been talking about infertility awareness, just bringing a lot of the different topics to light and to conversation, whether you're in it because you're personally experiencing the struggles of infertility, or you're a friend or a family member that has or is currently supporting someone going through it. And we are on our final week of the month. In case you lost track due to pandemic scheduling, you're not sure where you are in this year. We are in the last week of April. And I am so, so grateful that tonight we are bringing back a fabulous guest from October when we talked about pregnancy and infant loss. And so tonight we are going to have the distinct privilege and honor to have Tiffaney back, who is a licensed therapist in Maryland. And she has a special niche of working with families who have been struggling with fertility and pregnancy and infant loss as well. And so tonight's topic is PTSD.
Mm.
Who would have thought that someone who struggles with fertility is going to be having post-traumatic stress syndrome? It's like nobody ever talks about that, right? And nobody thinks about all the things that go with it. So Tiffaney, before we go any further, can you give us a little bit of information about you and who you are, and maybe some of your reasons why this is a topic of interest?
Yeah, absolutely. So nice to be back with you again. I can't believe like October and April have kind of just warped in time. Like, what is pandemic time? I just don't know if it'll ever go back to being the same. But yes, I am Tiffaney Mills. I'm a licensed clinical social worker in Maryland. And I get the pleasure and the honor of working with families who are trying to grow their families and supporting them along the journey of whatever that might show up for them along the way. This work is personal for me and people that are in my family and in my friend circle, and is much more common than people ever think about or are able to realize. So really just wanting to support people along the journey and help them understand some of the things that are associated with it emotionally and how that can have just as much as an impact on things as physically and financially and all of these other things.
Yeah, which oftentimes people don't think about the mental implications of like having to
Totally.
go through any of this. And that's, part of when we were talking in October is that like no one talks about the mental health impact of loss and the challenges and the struggles that go along with that. And so the more we have these conversations, the more we're normalizing that this happens and that there's nothing wrong with you for having these feelings and these
Yeah.
experiences, and that like the more we talk about it, the more you're not going to feel alone, and then you're going to know what resources are available so that you can get the help that you and your partner need, um, in whatever capacity that might be. So
Mhm.
yeah, so let's just get into it, because I feel like there's so much of the topic revolved around just the simplicity, though nothing is simple when it comes to mental health around this. But the simplicity that people often talk about is the grief and the anxiety that goes along with trying to build a family. But then we often overlook the impact of that consistency of like
Mhm.
test after test, surgery after surgery, and I don't like to use this next word, but I'm going to say it anyway because that's how people know it as failure after failure. And it's like the constant feeling of rejection in this society because we can't build a family. But it is quite a traumatic experience. And
Yeah,
it really
absolutely.
does leave, I guess we could say, like a long lasting effect that doesn't just go away with like one simple medication type of thing.
Absolutely. I completely agree with you. And I think it sometimes can even go a bit before that. A lot of people in my experience, and I know I did too, just assume that like pregnancy would happen naturally or easily. Like when we decide that we're ready to start a family, like we'll just like get the birth control out of the way and just do it. And I think in some ways people can experience that just like the struggle of being able to become pregnant or sustain a pregnancy as also traumatic.
Yeah.
Right? So I think it's just layered into the entire experience, and I think we need to, like, bring light to that alone, because it happens for both partners, right? Or one person might suffer in silence and think, "Well, like, this is my fault," or, like, "Something's wrong with me." It might impact the relationship and the raising of other children, and just so many different aspects of the things that we do, like, as far as career-wise and things like that. It's such an integral part of, like, who we are, and we
Yeah.
start to suffer those losses really early on, and those things really do have a huge impact on your mental health.
Yeah. And I think that like I think getting people to understand that they may have something more going on than just a bout of anxiety or the feeling of the lack of control or easily triggered and like
Mhm.
all these different things. So how do we even start the conversation with like educating someone or a group of people to be like, okay, these are the signs that you should really be looking out for while you're going through this, and kind of also addressing the partner, if there is a partner involved, like these are the things we need to be aware of. So where would we even start with that?
Yeah, I think each person is different and experiences, like, their own experience differently, and even within a partnership or within a couple, but I think sometimes it starts with, like, again, each person is different, but feelings of anxiety, like having some restlessness, sleeplessness, there could even be like crying or tears. People have a lot of bodily and physical sensations that kind of show up that allude to some of those things as well. I think it also comes into play like with your thoughts, just even the simple thought of something and that kind of like triggering some type of emotional reaction or physical reaction from people as well. Seeing something on the TV or driving in the car and noticing these things are kind of starting to show up. You hear an ad on the radio about, Shady Grove Clinic or whatever else it is. These are some of the things that might be alerting us that there's something going on emotionally that might need our attention. Because really, those emotions really are like information and kind of telling us, like, hey, I need to spend some time like figuring out what all of this means. Although that's totally not natural. Most of us don't just like, what's this thing? And let me go down this rabbit hole. We're like, no, let me like get on Instagram. No, let me go get a bag of chips or, do something differently. But it can kind of show up like that in sometimes.
Okay. And I think that's important for people to realize, like, instead of just brushing it off, that they can also validate themselves, I guess, in a sense of being like, okay, maybe I do need help and
Mhm.
I do need to talk to somebody and have more coping if they even have any coping techniques or mechanisms to like help them navigate it. But just kind of being aware, I think is usually it's the first step, right? Is like acknowledging that like something is off and I need help to be able to work through this.
Absolutely.
Yeah.
And sometimes like partners will see it or friends or family members will see like, oh, they seem a little bit different, like more isolated or more withdrawn and things like that. So just noticing any different variations from how we normally, right, or typically kind of show up are good indicators that maybe we need to be a bit inquisitive about some of the things that might be going on with us.
Okay. And then so then when that happens, how does one find somebody, because we know, as we even talked about in October, is that like not all therapists or resources specialize in working A with PTSD to begin with, and then B supporting somebody with infertility. And I know we had Julie Bindeman on for another session as well, and her go-to is automatically ASRM, which
Mhm.
is a great resource. But looking for ASRM members in Maryland, for example, there's not a whole lot.
Yeah.
So, what other ways are trusted resources for people to find a provider that would be good to at least see if it's a match kind of thing?
Yeah, so that resource is a great one, and I think this is a really important question to kind of answer because it's kind of not pointless, but sometimes if we're going to have the conversation, we need to be talking about how people can access the resources as well. So a lot of times people will talk about having a friend or family member who's experienced something similar and connecting and getting information that way. I think you can also start with like your healthcare provider and seeing if they have any type of information about someone who not only does this work but specializes in working with infertility and PTSD related to those types of things can be really helpful. PSI is a good resource that people enjoy using because they have specialized trainings for things like this that people can say, hey, this is something that I'm experiencing. I need someone who has specialized training or familiar experience in working and supporting people going through this process as well. So it's about really being like opening the doors and having conversations about things because sometimes these things can be so isolating and we don't want to like share anything else with like our best friend or even our partners or our parent or whatever that looks like, and just kind of asserting that and like I need some support in this, let me just ask my doctor, like, get online, see what I can do and see what I can find.
Yeah. Yeah. And I think that sometimes it is about just cracking the window open up a little bit just to be able to say, okay, does anybody have a resource or like a provider that would be? And there are a lot of resources. I know, because then the next question is, well, do they take insurance? And there are a lot of providers that do, and there are a lot of providers that don't. And so
Yeah.
I think that, sometimes that'll help narrowing down the list a little bit. And of course, like we wish mental health was like something that was standard of care and completely like free for all. But we're here in the reality of which we exist. And so it's about navigating that. And so I definitely do think that there are more providers now who are, at least during the pandemic even, that have been pushing themselves to get trainings because they know that this is a needed resource. And so I would definitely say that we probably, the good thing that came out of the pandemic is that like there's more available. People are realizing the things that needed to be, uh without using the word more available.
Yeah.
like we're starting to see an increase, an influx in some of the accessibility to some of those tools that are needed, even like between support groups and just finding individual therapists to be of support. um,
Yeah.
so we've kind of hit on this topic of partners. So can we talk about partners in PTSD during fertility and like what that might look like for somebody?
Yeah, absolutely. And one other thing I wanted to add too is there can be, challenges in accessing resources with location. Sometimes that's not as much of a thing with COVID because everything is like telehealth at this point. But like insurance, availability, wait lists, co-pays, all of these things. And a lot of people that I work with, and in my experience too, have found that sometimes it can be helpful to get some form of support while waiting on an opening or waiting on an availability of another like specialized area of support. Right.
Okay.
So it can be very discouraging if you're looking, you finally say, hey, there's something going on with me. I'm going to sit with this for a while. I'm going to say, okay, maybe I need to see somebody and talk about this thing. And then reaching out via phone and saying, oh, well, the wait list is
Mhm.
8 weeks long, or sessions are $180 a week, or whatever it is, that can be super discouraging
Yeah.
and make you want to just pull back further. And I totally understand that, and have personally felt that way myself. What's the point, right, of doing all of this? And it can, while asking those people too, are there any other referrals that you can make for me, or let me do some therapy with someone who might not have as much formal training, but can offer me some emotional support just in the meantime, because that can be also just equally as beneficial because things
That's so good.
can also be so isolating. And while we're continuing to build the resources and the respect and credibility that this field really deserves, just
Yeah.
like utilizing all the other areas that we can to get people the support that they need.
Yeah. I don't think a lot of people would even process to just start with someone, because it's like you don't want to interrupt what's going on, but B, um you just want to like get going with the person that you like set out to. But I think that
Mhm.
having something, that is such a really important thing to know. Thank you for sharing that, because
Yeah.
that's probably critical, because it could also be a lifeline for people, and it's not just a coping thing, but like you don't know how bad you're really feeling until you start kind of working through it with someone.
Mhm. And
Yeah.
you will be surprised by the benefit that comes from that. And I totally understand. Like, I want someone who can totally identify and can help me with this specific thing that's going on with me and my family. 100%. Right. And there might be other available options while you're working towards that goal.
Yeah.
Right. Because coming up against those other barriers can also have an impact on a person's emotional well-being. If we're already traumatized and hypervigilant and anxious and not sleeping and having conflict with our partners now, we're feeling really low, and then we try to reach out for help and that door is like slammed hard in our faces, probably not going to make us feel better alone. Right.
Mm.
So just like being willing to explore all the options while we do the important work of beefing up the resources for people who really, really need them
Yeah.
and deserve to have access to them.
Absolutely.
Yeah.
Yes. Yeah. Every person deserves to have access. So that's
Yeah.
like, ugh, that's like a hot topic. And but I think that if anything, like, we keep referencing like the 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 things that have been highlighted during this pandemic have been astronomical, and mental health being at the top of that list, right? Like, whew, yeah,
Yeah, and just like the disparities that come along with that too. Just
yeah,
like location and money and race and all of the gender expansion, all of these
yeah,
things are really, really, really important. And every single person it is their right to be able to have access to
yeah,
these things. And that's why we work so hard on getting them done.
yeah,
That's why people of particular groups suffer,
sure.
sometimes in different ways than other people do because it just looks different because it is different.
Right. Yeah, for sure. And that goes with like, I mean, we talked about that back in October, like, the Black communities struggle a little bit more with the getting the mental health resources because of the stigmas that are associated, and people aren't talking about it. And so, I mean, we can put it out there that, I think it's important that people be mindful that there are disparities in this, whether people want to admit to it or not. And we have to be having those conversations too. So,
Always, always. Yeah,
yeah,
just to lessen the division and more just make it more inclusive.
yeah,
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 yeah.
exactly. So, yeah, wow. Now I'm like,
Yeah.
oh, we should just stick on that topic.
I mean, whatever you wanna do.
Yeah.
Yeah.
So let's do go back to the talking about the partners, because we know, and like you and I prior to going live, we were talking about last night's event, which was focused around the partners and just them having. So some of the topics that we talked about was like them having the support. Who do they talk to vent to, and to kind of process what's going on? Because we know a partner's experience is going to be very different than the person who's trying to become, a birthing person, and that their trauma is going to look a little bit different, and their perspective on the experience is going to be very different,
Mm,
just as like them walking through it as while witnessing their partner going through it. And I know, and the topic came up, Mark, who was very adamant that we have to take care of our mental health, and we have to be talking about the connection of the mental health with the physical. And as a partner, we also have to address those needs so that we can be more present, we can be more mindful of the person that's going through it, while still dealing with whatever else internally we're processing. And so, how do we talk to partners about that? Because it's probably just as traumatizing for them as it is. I mean, in a different way. It's every individual is going to experience things differently. But
yeah.
how do we support the partners in being able to see that their experience, their trauma is just as valid, of being supported?
Reminding them, I think, that they're just not invisible. They're not just placeholders, right? A lot of partners say that they feel sometimes helpless or like, I'm not really sure what my role is in all of this because I'm not the person trying to become like the birthing person or to, have all of these things being done to me or these appointments centered around me. So I think it's helping just expand like you are a part of this process. Right. Your experience is likely going to be very different than your partner's experience, but no less valid, right? Everyone is still here and a part of this kind of process. And remembering too that you don't have to be going through the particular situation to have an emotional reaction to it, right? Often those things look different,
Mhm.
right? So you can be like if there's a fire going on and the person running into the building, they're going to have one experience. But if you're stuck outside watching this fire happen and this building crumble, you're going to have a different experience. And
Yeah.
both of those things are really, really valid. So I think it's one, just like reminding people you're not invisible in this, right? These things also can happen to you, and your feelings are just as valid. And we need to be catering to that experience also. Because again, it's about the unit for me, right? It's about the person coming in like, okay, I want to do this. I want to try this out. It's also about that person that's going to be supporting that along the way because they're also a part of this,
Yeah.
helping people realize too, how are my feelings changing? How am I feeling about my partner, about parenthood, right? How am I feeling when these things kind of show up for me? What's my mood kind of looking like? How am I interacting with my partner, with my friends, with my other children, with my career, with myself,
Yeah.
right? And just noticing any changes that happen that way too, and realizing it's together, right? It's not like pulled apart, because so much of the time partners feel that way, or
Mhm.
say to me that they feel like, I don't know, this is their experience. Like I just want to support them, and like they're going through all of this. And I'm like, I respect that so much. I just want to remind you, you're also, aren't you at these apartments too? Like, isn't this also a part of your family too? And I can sometimes see people just say, oh, it's like they almost need permission to say,
Yes.
this is a thing that's happening for me too. And I'm like, tell me more.
Yeah.
Right. Yeah.
Yeah. Yeah. And it's that was actually like pretty interesting in the conversation last night amongst the partners, because it there's such a disconnect and this sense of being an audience participant versus being like with the experience. And it's not just like an audience experience, whatever they call those types of theaters, like when
Yeah.
the audience participates. And I was just thinking that like I think even for friends and family supporting the partners, I think it's okay to be like, just as we would with the person who's getting all the injections and the tests and everything, to be like, so how are you really doing with all this? And, if you don't want to talk about it, it's fine. But letting you know, like, I'm willing to listen if you want to talk about how you're doing through it. And I don't think that people think to ask partners that. It's always, how is she doing or how are they doing? And, that's where we leave it. We don't even bother to think about that. And that probably also piles up too, I would think on
100%. I would totally agree with you. And I think a lot of times people don't do that in a malicious way,
right.
right? They think that they're being supportive and helpful. And I believe they are, that is their, way of doing these things. And it can also just be really invalidating when you're also having some feelings. And I find too that sometimes people don't even realize that they have feelings until someone's like, hey, Jesse, how are you doing with this? And they're like,
Yeah.
"Oh,
Exactly.
I actually might
Yeah.
have feelings about this, or I actually haven't created space or given myself permission to think
Yeah.
about the way that I feel,
Yeah.
because my role is to be supportive.
Right.
Right? We're going to these appointments and doing all these things too,
Yeah.
but it really is a unique experience for partners as well. Because I would imagine how, feeling like my feelings matter back here, right? When all these things are happening at the front. And I think that that makes sense to me.
Yeah. Yeah.
It
It's
has
it,
impact too, though, right? It's
yeah. Yeah. And
a entire process, like
uh-huh.
different rounds of like whatever it is that your choice is, and how sometimes that shows up a year later, 2 years later, 10 years later, all of these things. These are just things that happen that we experience that also deserve our attention.
Yeah. And
Yeah.
that's important. I really hope that people who are watching this like really take note to that, because yeah, there's no way I could have said it any better than what you just said. I'm just like, okay, so go on. It's so interesting. So like early on in the when everything was shut down, a friend of mine, I had a few friends, actually male friends, not just one. So if one of them is watching, it's not about you, it's about the other. We'll just put that. Had reached out because their significant other had lost their baby. So many, we've been hearing so much more about, pregnancy losses during this time.
Yeah.
And while they've all reached out to me, one specifically, I remember saying, "So how are you doing?" And their response was like, "Oh, I'm fine. Like I'm just worried about that." And I'm like, "No, no, no. Like really, like this involved you, and this you also had the same dreams and hopes and desires as they did. So how are you really?" They're like, "Huh. I didn't really really thought about it. And it's like, okay, so if you do want to talk about it, like these ears are open to hearing you.
Yeah, yeah,
But it was just, it caught them so off guard. And I'm like, it breaks my heart when people don't really think that they're equally a part of it. And maybe that's me sounding a little bit more personal since it is a personal topic. But,
yeah.
even on a professional level, my clients come in after they've had, either like there was a test procedure or they had a loss or something, and they're like, oh, it didn't work. And then it's like, okay, well, how's your partner doing with it? And they're like, well, I don't know because they won't talk about it. And so it's like, well, do they have resources that they can reach out to? And I think that we just have to have that as part of a normal conversation of talking about it because then it removes the stigma associated with that. And
Um,
that's, I think, really the biggest part of like having all these events during this month was to just constantly have the conversation going so that people get it. I hope the light bulb goes off and then it's like, okay, well, maybe it is okay to talk about it. Like, yeah, like we want cancer patients and their caregivers to be able to talk about it and to be able to
yeah,
get the support and resources they need. And I only mention that because that's my other specialty aside from reproductive health. And I want people to know, like, to me, I view that the partners are just as important in any of these
totally,
traumatic experiences.
totally.
Nobody set out to like struggle with fertility or have a loss. And, got to do what we got to do. And that means that we need to have support, whatever,
Yeah.
that looks like. Yeah. Yeah.
And a lot of times those losses can sometimes be like compounded on top of each other. It's like, okay, we weren't trying and now we're trying. And like the loss of like, okay, we're struggling with infertility. Right. And that like layers in and it's like the loss of being able to picture the expectation almost of like thinking it was gonna go this way and now it's looking way different. And the infertility process and whatever that looks like requires so much energy and effort and time and attention that it's really causing in some ways loss of your time and attention elsewhere.
Yeah.
So it's almost stealing so much of yourself to put it right here.
Yeah.
Right? And then we have to think about all the things that we're leaving behind and sacrificing. And we
Yeah.
might willingly be able to do that and want to do that because this is the thing that we really want to try to do.
Yeah.
And we still might miss those things, right? Or
Mhm.
really just like crave having that back. So it's all the ways that this impacts us as people, as human beings. And some of those are going to be intertwined as partners. And sometimes things might, impact a person in an individual sense.
Yeah.
And we need to just like think about those things and help people realize like, what are your feelings? Yes, we can talk about these things. Yes, this is a shared experience. And it's okay to talk about it because a lot of the times I feel like people don't know it's such a sensitive topic and such a personal topic that people don't want to say the wrong thing or they feel bad for feeling a particular way,
Right.
right? And it's just like all that judgment and that just gets in the way, right?
Ah,
So afraid to say the wrong thing or do the wrong thing or act nope, I'm just like in the supporter role and I'm just doing this or like I'll have people who are going in through the like injections and things like that who will talk about I can't complain about this like this is what I've asked for like I cannot and it's like hey,
yeah.
can it be both?
Yeah.
Can this
Yeah.
be
And the
something
answer is a big YES. Yeah.
a huge yes.
Yeah.
Absolutely. You can
Yeah.
willingly really want to give this your all and also struggle with aspects of it. We do this all the time with lots of different things, and it's almost like a different way of thinking to
Mhm.
expand. Like, yeah, these two things can like hold true at the same time, and we can kind of have these experiences. And sometimes people notice that that kind of brings more of an alliance together. We're like, oh, you feel this way too because
Yeah.
I hate freaking coming up here paying for parking every time we got to do this.
Yes.
Right? And it's like,
Yeah.
yeah, we're just like, we don't want to say the wrong thing. I want to be supportive. And I mean, it's hard, Jesse. It
Yeah.
really is. Like, we just have to continue to have conversations about things. And I think that our medical model needs to really include and give emotional wellness the respect that it deserves and letting people know, hey, this is a thing that could happen. Let's talk about this face to face and have a conversation about what this looks like throughout this journey. It might look one way today, and in 1 month's time, it might look completely different. Let's check
Sure.
in on these things.
Yeah.
You go to the follow-up of, yeah, you had a rash last time. How's your rash doing? Is it clearing up? Tell me how you're feeling. Like what's going on with these things? These things
Mhm.
are also important, equally as important.
Yeah. So if anybody is watching, because I'm seeing some emojis or whatever the reactions are that are coming through. So if you are watching and you feel like asking a question. This is Tiffany Mills. She is a therapist, a licensed clinical social worker in Maryland. She's amazing. And we're talking about PTSD and fertility challenges. So you can also put thoughts and comments in the comment section as well. So because I see you who are watching. I see you. I see you. I'm checking my notifications. Wink, wink, nudge, nudge. So, um, but I think it is really important that people realize that things are intertwined and they're also separate, and that communication is definitely like a key, because then that also helps to navigate, well, what do we need to do in order to process it? Maybe it is going to couples therapy even, so that they can process it together, and then also having your separate therapy time too. I've had a number of clients do that over the years. They just found that like they were struggling with like talking to their partner about just how they were feeling. And then that was the only time, like that week or every other week, whatever it was. So they would get it all out on the table and talk to their partner with the support of, their therapist. And then they also had their own session so that they could like do their thing. And I was like, that's incredible. Like, what an opportunity that if you're not going to be feeling comfortable in a safe environment at home, having somebody else to help facilitate the words and give you some prompts you like on how to effectively communicate those thoughts. Like, that's not a bad idea either, right? I mean,
No, I
yeah,
don't think so at all. I actually think that that can be quite skillful, especially because like we have so many things in our lives that sometimes when we are like depleted in some ways, right? When like your friend is sick, you like make them chicken noodle soup and you might drop it off, or like I'll pick the kids up from carpool, or yeah, I can come and do this. And we kind of need that same reprieve when we're dealing with big, heavy emotions, right? So if that means like I need to have my own individual therapist to kind of talk about how these things are impacting me and maybe how I'm not showing up for my partner in the way that I want to be, or how I don't know how to talk to my partner about those things, and then still going back and then doing that couples work as well,
yeah,
right? These things impact us in different ways. Or some people I have like they will have an experience of trying, um, and then going again and having experience where a person it does become pregnant and the partner is petrified based on past experience, and they're like, this is exciting, I'm also terrified.
yeah,
Can't tell my partner that because we worked so hard to get here. How dare I say this, right?
yeah.
These things are just like so natural. I could totally understand how that could be something that's just so confusing. It's all just so confusing, and we really need help to tease out like some of these things that kind of come up. Like people ask me, like, can I can't feel this way. Why can't you?
Yeah.
Right?
Yeah. Right. It's like, yeah, you can.
Yeah, and in some ways I get that, right? Because society has said you can't feel this way, you can't say this,
Yeah.
men don't do this, right? You can't complain, you asked to be
Right.
so I get why people are like, no, I can't. And we're just like reminding people too, you can have a varied experience. That's
Oh, for sure.
totally fine. You
Yeah.
shouldn't have to shut off parts of yourselves because everyone else is, you shouldn't do this or you shouldn't feel, these types of ways. And it's just like coming to a place where we feel like we can say those things. And
Mhm.
it's like, I can say this. I can say this to my partner. I can have these conversations with my partner. I can grow through this experience,
Yes.
right? And know how these vulnerabilities now show up for me,
Yes.
right? And I think that's kind of some of the work that you will do with your therapist too.
Yeah. Yes. Yes. Vulnerability. It's so awkward, but almost important in some ways too, because it reminds us of us being human, and that, we
Totally.
have our brain works in these mysterious ways of letting us feel the things, even if we don't feel comfortable feeling them. And it's good to give those feelings a name. And
Yeah,
sometimes like naming that can be really, really helpful
yeah. That
processing.
vulnerability will show up. It'll
Yeah.
kind of like it's that reminder that I was doing something really important was going on for me, right? And when that vulnerability shows up, I'm just graciously reminded of
Yeah.
that. And in
Yeah.
the beginning, I need some support because I think it's really, really heavy and it's really, really hard. So I
Yeah.
need some help getting through this and
Mhm.
then just learning how these vulnerabilities show up for us in different ways.
Yeah.
Like
And it
over
was so interesting in the partners conversation last night, because the partners were talking about like, like I just need to be here for them. Like I'm supposed to be a mind reader, but I don't really know. And they don't know how to tell
yeah,
me. And it's like, well, yeah, that's true. But again, it goes back to like you're allowed to tell your partner that like aren't feeling great and that you are sad that they are going through these things. And
Yeah.
it is heartbreaking for you because as partners, whether same sex or not, or, hetero couple, like the partner usually is the one, somebody always wants to be the fixer of everything. And when you can't
Totally.
fix it, that's so much more of a grief,
Yep.
and trying to like process like, okay, well, I'm just gonna let them tell me everything and I'm just gonna witness everything. And
Yeah.
so yeah.
And
Oh,
that can be a burden too, because people really like a lot of times people talk about feeling helpless
mhm.
and they really don't like that. And I think just the burden of realizing that like I can't do this
Yeah,
for this person that I love so much and want to do this and experience this thing with. Like I'm really grappling with the fact that there is limited that I can do to change the outcome of this.
yeah,
Right. And sometimes that like sends different feelings and emotions and things like that too. And it's like, it's just so many different things that can be thrown your way. And I think this is why we need to have those conversations because it's not cookie cutter. It doesn't look like the exact same way or this one way. This thing is big and complicated and rough around the edges and like it's a big ball of stuff. And we
yeah.
just need to like be able to work some of that stuff out and realize that like it's okay. This might show up in this way. How is
We
this?
don't want
Don't want to.
to.
We totally don't want to. And I get why we don't want to. And
Yeah,
I think that kind of comes to the point of being able to have and achieve some sense of healing throughout things. Because it's very, very hard, very, very traumatic, and can be very, very damaging.
yeah,
Right. And these vulnerabilities have a way of us kind of making our lives about that thing or really never like recovering or really processing through some of those things. So
yeah,
it's about taking the time to do that and be able to have like maybe a different relationship with it, like on the end, if a
yeah,
person chooses,
yeah,
right?
yeah,
Yeah,
yeah. And that's important to validate that part of that experience too, is that, you have to want to move forward with that type of support and just the acknowledgement piece. um, because otherwise then it's forced. You're not going to want to like look at it, you're not going to want to process it, and you sure as heck aren't going to want to talk about it to anybody for sure. So if we can just do like a recap of like, because we mentioned it in the beginning, but like what okay, how did I had it in my head and it sounded really good, so now I'm trying to get it to like be verbalized.
it'll still sound good.
Can we recap like what the signs of when we need to seek help would be? And then is there something that we can have as like a takeaway of some sort of like a breathing thing or something that we could yeah, that we could have it to take away from this chat? Okay.
Yeah. So I think it shows up for different people in different ways, but a lot of times just like even noticing anything different than how you normally or typically are, right? So if you're having lots of intrusive thoughts about something, like images and nightmares, difficulty sleeping, changes in your mood, interpersonal kind of conflicts, noticing that you're more withdrawn. A lot of people talk about having physical sensations and bodily things like that. These are some indicators that maybe we need to be spending a little bit more time focusing on what these things are trying to tell us, because our natural reaction is going to want to be to distract away from that, right? Especially because life doesn't stop just because you're going through infertility, right? These other things are still demanding so many things from us. So if you're noticing these are showing up, then maybe this is time to have a conversation with someone about maybe seeking some support elsewhere to kind of get your emotional needs met there, because they deserve that and you deserve that.
Yeah.
You don't have to suffer in that way, and most certainly not alone.
Keyword, if you're watching this, you are not alone.
Not at all. It's much more common than people think about. And lots of times, well, I didn't know I don't talk about this, but I realized that my best friend or my coworker or, whatever, we all have these shared experiences. And it's because it can be so shameful. Like I shouldn't suffer from this. This is not something that should be affiliated with me. And it's like, you didn't do anything wrong.
Yeah.
It's not your fault.
Yeah.
Sucks nonetheless,
Yeah,
right?
for
But it's
sure.
not something that we have to I did this thing to cause this thing. Yeah. I love me some breathing exercises. I think they can be really, really helpful, especially when people are having some like emotional dysregulation. Really being able to use the breath to kind of regulate some of that is quite powerful. And it's my favorite because your breath is always with you. You always have it wherever you go,
Yeah.
right? So even right now, as we have it, I touch my chest a lot because it just reminds me that there's life inside of there. And that can be really, for me, exciting. And other times when it's hard, I'm like, whew, I really need to connect with this right here because it's a hard day, or
Yeah.
like things are showing up that make it really difficult. So I really enjoy being able to just like mindfully breathe in through the nose and holding that breath for whatever count. I usually count to 4 and an in breath, holding, and then trying to blow out for 1 second longer than you breathed in, right? So if we try again, breathing in 1, 2, 3, 4, breathing out 1, 2, 3, 4, 5. Our body chemistry changes when we're spending more time doing exhales, right? Regulations in our blood temperature, our blood pressure rather, all of these things really help with like our emotion regulation. So just like mindfully practicing it, not just like in the back of our head, but really sitting down. I oftentimes will put my hands on my chest to feel the rise and fall of my chest as I'm breathing and really noticing what's happening as I'm supporting my breath in my body and what that's doing on the inside and the brain and all of these other things.
I love that. I feel like now that you're like mentioning that, I know I do this a lot. And so now I'm like, oh, I do that.
Yeah, it's just
Yeah.
like very comforting and to some, and just my heart's here. And for me, when I experience big emotion, my heart lets me know because my heart is like, all right, so I'm like, okay, I'm here. There's something here that needs me. Let me figure
Yeah.
it out how I can deal with it, or let me call somebody because I have days too where you're just like stressed and overwhelmed, especially with like the pandemic and all these other things. It can be really hard. So I have to tag my friend in and say, hey, can we take a walk at noon in between Zoom meetings? Because I need to get out of this chair. I need to be moving around a bit more.
Yeah.
And it just helps to be able to connect in that way.
Yeah. Oh, I love that. Tiffany,
Yeah.
you're so amazing. I
Thank
feel
you.
like we could be talking like all night about like all the
Of
things.
course we could.
And
Yep.
yeah, right. I mean, it's it's early and neither of us have anything else going on. I am so so grateful. Tiffany Mills. Oh my gosh. How could people like find you? Are you on Psychology Today? Are you uh do we have a website we can share?
Yes, yeah. So those are all good questions. So on Psychology Today and milestonemh.com.
Okay.
Yes.
Okay.
Yeah.
Yay.
Yeah, I can share that with you and we can share it with people as needed. So they can get the support that they need and just like make connection, especially during this time when things can feel so divided and isolated.
Yeah.
Yeah.
Yeah. Awesome. So if you are watching this, Tiffany laid it out there. You're kind of a normal person if you have feelings and you're validated if it's sucky feelings.
Yes.
And it's about recognizing the signs of when it might be time to get help, especially dire help.
Mhm.
So please be mindful of that. Share it with friends. Reach out to a friend and maybe also their partner.
Yeah.
Have your partner reach out to their partner, kind of thing. This is definitely, going through fertility struggles is no easy journey. And as much as it's a very isolating and very private and sacred time in a person's life, sometimes we do need community to make sure that we are still moving forward in whatever capacity that might be.
Mhm.
And I think that sometimes we often don't really know the value of what that is until we open up and allow for that to happen. And I think that's really important. And so, my dear friend just said, thank you. This was a wonderful discussion.
Lovely.
Um, yeah, yeah. And I want to just give a shout out for anybody who's watching that tomorrow night, Aladrian, who just commented, she is one of the co founders of the Baltimore based theater company, Two Strikes Collective, and she's an amazing human, and she's probably blushing because I'm saying this right now. But tomorrow night's event, Aladrian found on her journey the power of playwriting and using her creativity to be able to share her story through infertility and loss. And it started with a play that she wrote a few years back called Infertile Grounds, and it was so amazing to go for the
Mhm.
play reading or what stage reading, I think that's what they call it. Adrian, you can remind me later. But it was about, that was a pivotal point in being able to break the ice for her. And tomorrow night we are having it where she is sharing several of her plays. I think it's 4 or 5 of her screen or playwrights that she has created, and we're gonna watch them and we're gonna have a post discussion about them. And so, really touching on a lot of valuable things from a Black woman's perspective of what it's like to go through infertility and loss, and just the process in general, and our partners, and dealing with the medical institutions and all of that stuff. And so, so if anybody is watching, join us tomorrow night. Link is on my Moksha Massage and Wellness events page, or you can go to mokshasoul.com and you can see the event information there. So please, and all the events are free. And then Friday's event is with a wonderful woman who is going to be talking about how do you make the decision of when enough's enough, and the journey to childless not by choice. And so I'm really, really excited about all of the rest of these events. What a way to wrap up the month of April. And I'm grateful for everybody. And Tiffaney, I cannot thank you enough. One of these days, we're going to like connect in person. I'm going to be able to give you a hug, and it's going to be amazing.
Yes. I so look forward to that. So look forward to it. I'll settle for virtual for now, but
okay, I will too. All right, Tiffaney, well, hold on one second. Everybody else, have a beautiful evening, and thanks for tuning in. Bye, everybody.